ASH hosted 10 scientific workshops this year featuring interactive discussions covering the latest scientific developments in a range of hematologic topics. AI is a hot topic across all industries, and hematology is no different. This scientific workshop addressed how AI strategies can help reshape the traditional clinical trial paradigm for real-world patient representation.
This workshop is going to go a long way into giving us some concrete steps, actionable steps of how to integrate different strategies of incorporating these decentralized clinical trial elements into every clinical trial.
There are many people for whom the participation in a clinical trial would involve time away from work, a lot of travel time that they don't have to spend, time that they don't have to give. So we're making it easier for people from various walks of life to be able to participate in clinical trials, as well as kind of capture them in their own environment.
Clonal hematopoiesis of indeterminate potential, also known as CHIP, is linked to various disease states and is heterogeneous with respect to its impact. This scientific workshop shed light on novel mechanistic insights into CHIP-associated pathobiology, including the challenge of translating these insights to novel secondary prevention clinical trials to prevent CHIP-associated disease from occurring.
This is the intersection of genomic medicine and pathogenesis of disease in a manner that we've never really explored before. I think this is probably one of the more important discoveries in the last decade in medicine, period. And it affects all different kinds of medicine. It's important for hematology because we're interested in the blood cells, but these cells are everywhere and affect tissue types of all kinds.
It's really a new discovery with a lot of impact, and that is get interface with several disease and research opportunities to open the way for several research programs.